Bronchomalacia and tracheomalacia. Malacia means softening. So softened bronchus and trachea. It's also another name is croup, causing the inspiratory stutter, difficulty and loud noise while the child takes air into the respiratory tract. So it can be primary, the congenital absence of the cartilage in the trachea, in the bronchi. Secondary, when the trachea and bronchi are obstructed by the vascular ring, esophageal atresia, connective tissue disease, and your fistula, tracheoesophageal fistula. Presentation is wheezing with your inspiratory noise and then your barking sort of croup. At times, inspiratory collapse is quite high, and thereby you have complete obstruction. You have quite loud noise. Clinically, it's quite a frightening sort of things. Parents say, "So look, doctor, it's really really anxious and frightened." So it can be triggered by the intercurrent infection, a respiratory infection, tracheal infection, upper respiratory infections, lower tract, etc. So it simulates pneumonia and croup chronic aspiration. So exclude these three possibilities before embarking into the diagnosis of bronchomalacia only, tracheomalacia, and then diagnosis of bronchomalacia and tracheomalacia is your bronchoscopy, CT scan, and your to exclude the ring around it, secondary bronchomalacia or tracheomalacia, where you have vascular ring commonly. So exclude those things by MRA and or MRI with angiography. Treatment of brachiomalacia and bronchomalacia and tracheomalacia is postural drainage. Nebulized iprentropium bromide, not salbutamol albuterol, because these two may exacerbate the airway patency, may cause by decreasing the tone of the trachea and bronchus. Thereby, iprentropium bromide, the anticholinergic as a bronchodilator, is good over here, and continuous positive airway pressure via tracheostomy, and in life-threatening sort of disease, you need to do bronchopexy, iotopexy, and your finally endobronchial stenting may be needed in some of the worst possible cases. So diagnosing the bronchomalacia and tracheomalacia and understanding the severity and doing the appropriate thing is essential.